Sexually transmitted infections Condom Awareness Week, and the City of Cape Town has urged people to practice safe sex. The city's health department says there's been a massive drop in the use of condoms, coupled with a rise in the number of STI infections. Well, for a discussion on a national scale, I know TAPS is going to speak to Dr. Tato Chidakira, and she's the National Health Department's Director for HIV and STI. TAPS, I know that you chatted to the doctor beforehand, so I'm passing this one to you.
Yeah, well, the situation is one that's been revealed in Cape Town, and Dr. Chidakira is from the Health Department, Department for HIV and STI Prevention Strategies. Doctor, thank you so much for joining us. How was the data that we've seen from the City of Cape Town collected, and why is there such a stark decrease?
Okay, good morning, and good morning to the listeners. So in general, if I can just give just a few seconds of background in terms of STIs and their relation to condom use. Condoms remain the cornerstone for prevention for STIs, unplanned pregnancies, as well as HIV. And availability of condoms coupled with the correct and consistent use has been shown to reduce infections and transmission of HIV and STIs, as well as to prevent unplanned pregnancies. So in the past 2 years, where we had COVID restrictions, not just South Africa, but most of the world was affected by all these commodities. If we remember, or maybe we may know, that condoms are imported. South Africa does not manufacture condoms. We have one supplier who actually does some manufacturing. So due to the hard lockdowns, condoms were not necessarily very much accessible or even available, because we were actually struggling to get them from abroad. There were challenges of shipping, as some of us may know. There were challenges of manufacturing, as manufacturers were actually working on like half or even skeletal stuff. So a lot of the past 2 years were affected by that. And Western Cape, just like most provinces, including KZN, Gauteng, Eastern Cape, provinces with high population, were actually affected, because this did not just affect condom production, but most health services at large.
I was under the impression, Doctor, that condom use was in decline in general, even before the pandemic and those logistical troubles you speak of.
Yes. The last time we had our National Household Survey through the HSRC, that was in 2017. And that was already showing that, looking at the last 4 years, 2012 to 2016, condom use was on the decline. And this is why the Department of Health responded and actually consulted with especially the young people, where we saw the major decline in terms of what is it that we're looking for. And that's when we transitioned in terms of brand positioning from the choice as a national brand to what we call now Max and Maxima, which we have just shown now. And we actually went there to actually try and improve and increase condom use in general. However, what we're seeing now is something that was majorly affected due to those disruptions in terms of service delivery. Because if we're looking at our procurement and distribution in the past 5 years, we come from distributing and reporting about 800 million condoms, male condoms distributed, to from 2020 just over 500 million. So there was a decrease of about 200 million to 300 million, and this was mainly due to supply. Yes, we acknowledge that, and supply was affected majorly by the hard lockdowns. And I do acknowledge that, yes, there was a decrease in general, but this steep decrease that we see now was based on the fact that we were unable to actually procure or even bring in condoms due to either shipment challenges or manufacturing challenges, because condom tender is actually centrally managed as national treasury and then decentralized to provinces.
The decrease in the use of condoms leading to a rise in STIs, and there's a huge risk in leaving those STIs unchecked. Is there a chance that we might, like other countries, start to worry about outbreaks of STIs like syphilis or resistant strains of gonorrhea, for example?
Right. So South Africa is unfortunately one of the countries with quite a high STI incidence. And if you start kind of like disaggregating the causative agents, like talking about issues of syphilis, gonorrhea, we are actually, as a department, working towards elimination of neonatal syphilis at this point. And we're trying to put together dual testing for antenatal clinics for pregnant women to try and manage that. And we've also tried to work towards procurement of the drugs to try and work with resistance. So in terms of the general population, we are actually managing STIs syndromically, which means that in a facility, we look at symptoms and we don't necessarily do causative agents per se. So we don't do lab work, except in different cases where maybe one keeps coming and we have maybe a question mark of resistance. But in general, STIs are managed syndromically, which means that we actually rely on symptoms. So now is February, and February is SRH month. And this week, we'll be starting with Condom and STI from the 12th to the 16th. 10 to 16 is pregnancy awareness. And these are the times that we plead with the communities, especially with the young people, to use condoms consistently and correctly, and to ensure that if there are any symptoms, they go to a clinic. STIs are treated for free, and STIs can be managed and they can be treated. But if one does not treat, then they can infect and continue to transmit, and that is where then we start having challenges.
Dr. Tatosh Darike, thank you so much for your time. That was the doctor from the Health Department, the Director for HIV and STI Prevention Strategies.